This House is against the motion and believes that there is indeed ethical justification for the act of suicide. In 1961, under the Suicide Act, the UK decriminalised suicide and any attempted suicide. The strongest justification for suicide is in the ethical principle of autonomy. This is defined as the right of every individual to self-determination. Simply put, this means life belongs purely to oneself and no one else. In medicine, autonomy means acting in a patient's own wishes. If a person shows rational competency, then suicide can be their capacitous decision. As Thomas Sayers commented, freedom is ownership of one's own life and body. Suicide is an autonomous decision, is supported by many philosophical arguments, such as the libertarian view. Similarly, existentialist philosophy argues that life has no meaning. Thus, really, one has to justify not killing oneself. As philosopher Jean-Paul Sartre said, "One lives one's death, one dies one's life." To rebuttal the opposing house, in rational suicide, there is a conflict of duties between the autonomy of the person versus the beneficence and non-maleficence of others. However, autonomy should precede all other ethical considerations. To deny and disrespect a person's rational choice would be unethical. Furthermore, we argue that in fact the ethical principles of beneficence and non-maleficence support the act of suicide. Life is circumstantial, and for some faced with chronic pain, suffering, incurable conditions, and the loss of dignity, suicide can actually be acting in their own best interest, thus the principle of beneficence. Likewise, with non-maleficence, suicide may act to prevent worse harm if the person to remain living. David Hume stated that a person does no harm in committing suicide, but merely ceases to do good. The obligation to do good in society should not come at the expense of a miserable existence or greater harm to oneself.